Good afternoon, everybody. Can you all hear me? Wave at me, please, if you can hear me. Give me some signs. Thank you so much. Thank you for being here today. We're here for the 360 White Paper official launch and the social care debate. So firstly, thank you for making the time to be here today. I know you've all got busy schedules, and it really highlights how passionate you must be about social care to be here. So I'm going to be hosting the session. For those of you that I haven't met in the audience, my name's Hannah Montgomery, and I run a company called Goldust Marketing. So my background is the last 20 years supporting the majority of the care tech providers in social care. Thank goodness for Botox. And also, I run the Lichfield arm of Contact the Elderly, which is now re-engaged in my spare time. So what did we do, and why did we do it? So in March, we hosted roundtables where we got everybody associated with social care to come and discuss the issues within the sector. So we got representation from local authorities, care homes, home care providers, care charities, the care workers themselves, people receiving the care and their families. We also got people supplying into care, so care recruiters, care tech providers, all of those kind of people. And we also got social care thought leaders and just anyone that was passionate about social care. We got along because it's important for everybody to have their say so we can see holistically the whole issues for everybody and how we can put solutions in place. We also found it really important to pay the care workers and the people that were receiving care for their time at £20 an hour, because I really didn't think it was very fair to get them to give up 2 hours of their time when they could be delivering care and them lose out financially, as of course costing care is one of the issues that we'll be talking about today. So you'll have on your seats a white paper, which is the outcomes outlining the solutions on your desk. If you don't have it on your chair, don't worry. Come and grab it at the end. We've got another supply so we can make sure that everybody gets a copy. So the aim of today is to have a panel discussion with some of the panelists that were involved in the roundtable to discuss some of the issues. So it will be a Q&A session at the end, so be mindful if you do have any questions, make a mental note of it, and we're going to come at the end of the session and come and ask you for your questions to be directed to the panel as well. So let me introduce the panel, and then I can stop talking and we can get going. So everybody, could you please extend a warm welcome to Adam Hutchison, the CEO of Belmont Healthcare Group. We've also got Adam Pennell, the Director of Social Care from the Institute of Health and Social Care Management. We have got Jane Townsend, there we go, CEO of the Home Care Association. We've got Lee Truman, Commercial Director at NDG Artificial Intelligence. And we've got Mark Tops, the Business Manager from Essex Cares. So the first question we're going to go with is the new Health and Social Care Levy and the Chancellor's spring statement. Will it solve the crisis? So I'm going to ask if Mark could please take the lead on this question.
Hello, everyone. I think for me, the report highlights the need for clarity, and I think we have the government's Heart of Care reform white paper, but I think the government's failed to kind of communicate that effectively and to get kind of the message out. Leading up to this, I did a poll online, and only 16% of people that responded had either heard of it or had read it. So I think there's a massive gap in that kind of reform paper kind of being known about. I think when you kind of look at social media by the politicians that we've got, a lot of the talk is about the NHS, and how that money is going to be used to, build diagnostic centres, speed up waiting times, but actually nobody really mentions social care, and it seems to have been forgotten about. And I think, there's a strong message that we can't fix social care if we can't fix the NHS if we don't fix social care. I think the levy itself, we've got a large majority of the workforce that are on low pay, and actually with increased utility bills and, the wages aren't going up, the levy itself just introduces a new additional amount of money that they've got to find, and actually the lowest paid are the hardest hit. I think some of my work that I do with NACAS, we've actually heard from care workers that have actually said, they're on the benefit system, but actually they're finding that they're actually better off to rely totally on the state. And that's not what we want. We don't want people leaving the sector because they're harder off. We want to introduce people into the sector. We don't want people, to come to work to not make any money. I think for me, the white paper really highlights that there's a major recruitment issue, and we know that. But actually, I don't think the government kind of got a plan that's really going to fix that. I think it's ironic that the care workforce that has kept us going through the pandemic are the ones that are going to be hit hardest. I think, talking about the government, they have that clear vision for social care, but I think us working in social care, we're still waiting for what that plan is. I think there's a lot of kind of talks and people talking and having meetings, but it's the same kind of things going on, and nowhere actually moving it forward. I think the levy itself doesn't come close to fixing some of the issues that we face in either health or social care. Instead, it just penalises most of the workforce. I think we know that there's over 500,000 people waiting for home care in England alone, and I think we need the government to ensure that they're held accountable for reform, and that it's actually a reform that equally benefits both health and social care. Thank you very much.
Anyone else got anything else to add?
I just find it really interesting that we've got a social care levy. It was pinned as a social care levy. We are increasing the money to support social care further. And within the space of 6 months, it's now become an NHS tax, which we're being privileged to having 5 billion of. And there's got to be something about having this parity. I'm not going to sit here and go, we don't want to be friends with the NHS. I'm not going to sit here and go that we don't want to work together. But the approach they've taken to this levy, the way they're dishing out the money, is only going to further the disparity between the two sectors. I use the term sector loosely. What we need to be doing is using that money to bring unity together. We need to be looking at this 36 billion going, how can we spend this to not only improve social care and fix the problems, but bring both sides together? How can we use this to shape a real future for health and social care? And we failed to do it. We've got till 2023 to use this money. Nothing's going to be put in place plan-wise, and I just feel it's going to be a case of, oh, we've got all this money, they've done nothing with it, so what was the point, and what was the point in that exercise? It was poorly planned, and I worry that unless we actually work together moving forwards with those funds, it's going to be for naught.
Go for it, Jane.
Yeah, I think some of the key problems that the NHS has with reducing waiting lists can't be solved just by throwing money at the NHS. Inability to discharge people back home, to access home-based support and care and other community services is reducing the ability of the NHS to admit new people, and that means that ambulances can't drop people off quickly. So it has an effect through the whole system. The NHS isn't going to be able to meet its targets unless the funding is distributed more equitably. But the challenge is that politically, voters like the NHS, and as the politicians see it, there are no votes to be won in social care. So that's what we've got to try to do, and actually work. Actually, a lot of NHS chief executives and other senior people are saying exactly the same thing.
Yeah.
They want money to go to help, community-based services. So that's where we need to try and encourage more action.
Go for it, Adam.
But one of the major things is it's a campaigning piece, because all of the people in this room who've come here today and we're talking about it, we're in social care, so we understand it. One of the wider issues is that there isn't that same campaigning going out into the wider public domain to say to people, this is what social care actually does. You only use it when you need it or it's in crisis, and then you go, oh wow, let's campaign, let's get involved in a charity, let's work for it. That's great, but the problem is we have to be further down where decisions are being made. And ultimately there needs to be a clear message, which the NHS is there to fix acute emergency issues across the public domain, and social care is there to support people afterwards. And it's actually that, in my opinion, humble opinion, it's that simple, but nobody ever discusses that. And we all know that social care will actually solve some of the issues within the NHS. So the message needs to get out so people can campaign more and can actually have an opinion, so that when it comes to making a choice on the services that they need at a particular time in their life, they're made, they can turn around to a local authority and say, no, that's not what I need, I want this, because they know what they need rather than being told what they need. So votes are cast because people assume that's the process. Oh, it's the NHS. You talk to somebody over the age of 65 who potentially has, early onset dementia. If they have an issue at home, the first thing they're going to do is dial 999. That's inherently ingrained in our society to do. But I can guarantee you that probably 95% of the time that's the wrong solution, because it could be fixed by something in social care and take the pressure off. But nobody talks about solving that. That is ultimately what we need to do with things like this in terms of campaigning for a wider understanding of what the services do, or the sectors, as Adam put it earlier.
Sorry, I think you make some really good points, and I say sector loosely. I think the fact that we use the word sector when we talk, and I said this morning, didn't I? When we say social care, we inherently follow it up with sector. So we go social care sector, social care industry, and actually social care society. And if the government could take some of this money, some of this levy, and go, I tell you what, all public-facing roles, be that taxi ranks, be that shops, be that restaurants, are going to go through disability awareness training. It's going to be mandatory. It's going to be mandatory that everyone goes through dementia awareness training. If we can rope the rest of society into understanding what people in society are living with, the return on investment for social care will be incredible, because it won't be a burden on the industry, on the sectors to do it. We're going to put that ownership back into society as well. It's about making sure everyone's aware of the issue, and it would help with the campaigning aspect to get people fully on board and fully invested.
Fabulous. I love the passion already. I love it. Right, let's go on to our next question, our next topic. So, regulators, the CQC's new strategy, what will the impact be? So if I could ask Adam, Purnell, if you'd lead on this one, please.
I'm going to preface this like I do with my chat show every week, and the views are my own and not of the Institute's. I am an ex-registered manager. I am a home care manager. I was a residential manager. I spent the last 3.5 years of my role uninspected. We'd got one inspection, and then 3.5 years later, I left my role, joined the Institute with no inspection. And I feel that we put so much trust within our regulators to tell us that we're doing well, to tell us that we're succeeding and that everyone's happy with our care. The fact that we pay them to tell us this, we pay them our service fees for them to come and tell us how rubbish we are, I think is an insult. And I will always remember an email I got right at the beginning of the pandemic. We can't do anything. We can't come into your care home. We can't come to your service, but we trust you to make those right decisions. See you on the other side. Good luck. And we had no idea how long this pandemic was going to go on. And in that, they've decided to look internally and rebrand and go, this is how we're going to approach things. This is how we're going to become better to make it easier for care providers. The one thing they have failed to realise is care providers are time poor. So it is going to be great to have an inspection system which is more fluid and more constant. But in doing so, it's going to require more data input from the providers. It's going to take more time to fill these forms out, to fill these web forms out, alongside everyone else who's hungry for our data, because everyone else wants to know what we're doing. Everyone else wants to know what we're achieving and what we're not achieving and where we're failing and where we're succeeding. And as managers, we're going to become complacent. We're going to go, oh, I'll just put it the same as what I did in the last month. It'll be absolutely fine. Nothing's really changed. And then what we'll do is we'll end up with the same data that Skills for Care have from the adult social care workforce data set, which no one completes properly. And then we've got a load of data that Skills for Care go, isn't this fantastic? And this is what the sector is telling us. And yeah, the sector's telling you that because they're fed up of putting data in somewhere. What we need is an intuitive regulator that's going to come to us and go, right, before we ask you what you need from our inspection services, we're going to go to the people you're supporting. And we're going to go to them and go, what do you want to see from the regulator? How should we be regulating your services? How should we be looking at how well your provider is doing? I think for providers, we're getting so hung up on this idea that CQC are the be-all and end-all. We all want these stars. We want to become outstanding. And the minute we start thinking we want to become outstanding to get that from the regulator, we're losing touch with the fact that actually we want to make sure that the people who are receiving our support think we're outstanding. Because if they don't, and if CQC come and go, oh, this is staying in a 5-star hotel. It's got 5 stars. It's wonderful. It's amazing. You go, oh, I'm telling everyone I'm staying in a 5-star hotel. And you go and the service is crap. But it doesn't matter because they're a 5-star hotel and everyone knows they're 5 stars. If you're an outstanding care service and you've got your outstanding stars, wonderful, amazing. If nobody in your service thinks that you're outstanding, it's not worth its weight in gold. It's just pointless. And it's this idea, it's this mindset that they're going to continue with their new inspection framework. It is losing touch with the people and how it actually matters. I feel a bit of a fraud. I'm 6 months removed from the care sector. So please sit here and tell me I'm wrong. But I don't have the hope that this new way of inspection is going to work. I feel it's going to benefit the inspectors. I remember mid-pandemic, We know what it's like being a manager. You know, you never clock off. You never clock off. I got a malicious safeguarding alert. It was completely malicious, unsubstantiated. 4:30 in the afternoon. It went through safeguarding. It went through CQC. It went through Public Health England. And I phoned my inspector and said, look, I'm stuck here. I've got a pandemic. So safeguarding can't come in and look at my paperwork. I've got Public Health England on the phone at me, screaming at me. I've got families phoning me up concerned. Adam, it's 4:30. Can you phone me in the morning, please? I'm about to clock off. And how is that a world-class regulator? How is that going to be addressed with us putting more data in? What we need is more input from the actual regulators themselves, not from us. They should be asking to help us, not asking us to make their jobs easier. But, you know, it could work. So that's my view.
That's all I've got for this time for this.
Sorry,
No, gosh,
I apologise.
No, I love it. I love it. The passion is there, which is exactly what we want to do. So this is one of the big questions, really, that I'm going to lead with the other Adam to take on. The cost of care, what other support could help?
Okay. I don't know. No, joking. So the cost of care is a really interesting one because it's an awareness piece. It's about bringing things out into the public domain for people to understand actually what's delivered when you're looking at a care service. So let's just break down a care home as a facility. You know, it is essentially a private dwelling that's offering care support for an individual. And I always use the analogy of looking at your own household and what has happened to that household over the last 12 months and what's going to happen over the next 12 months moving forward. The cost of those initial sort of what we call hotel and management costs are just gradually going like this every single day. And, you know, there is no support for everyone out in their own general homes, so you can imagine what that's starting to put pressure on a care service. Then we want to all employ a number of people. Mark mentioned earlier on we have a huge recruitment problem. So how do we inspire people to come into a sector which is essentially struggling to recruit? So we have to break the back of what care actually does. We have to make people aware of what care actually does and how it supports people not only in the community, which I'm sure Jane can input on in a bit, but certainly, you know, I'm a care home operator predominantly, and so we face a series of challenges. So we've got two options. What we could do is we could sit there as probably, I've been in this sector now for nearly a decade, and I've gone to loads of meetings, loads of conferences, loads of trade association meetings, and you get the same people around the table all moaning about the local authority don't pay us enough, the local authority don't pay us enough. I was around at the Outstanding Society stand around the corner, and I was having a chat with one of the outstanding operators over there, and we were looking at each other and saying, well, we don't actually have those challenges in terms of cost of care. We support other people and we talk to other people. Why is it that we don't have those challenges? It's because we have to set the stall out about what it is and be proud of the services that we deliver and get the right return for those services, which in turn creates good quality. So it's about having that stronger approach with your funders and remembering that there has to become a mixed model. We can't rely on purely privately funded care. We have to be able to look at the model and say, right, we need an input from certain people over here, whether that's privately or through an insurance policy. We need to have an input from the local authorities, but we also need to have an input from health, because by using campaigns to get health more involved in what social care does, there's actually a saving to be made. Nobody's really talking about this. It drives me mad. If you look at, there's a hospital in Kent, and the per bed price for having somebody in a supported environment in a hospital costs £668 a day. Times that by a week. There's no care home in the country that charges £668 a day, yet that person will have more engagement, more enjoyment, more companionship, and actually rehabilitate. Because we all know that a hospital is normally the worst environment for somebody who's in, who maybe has dementia or Parkinson's or sits on the elderly spectrum. Again, that's my experience, is that they're going to be negatively impacted by spending too much time in hospital. So again, it goes back to awareness, it goes back to campaigning. So we're stuck in this perpetual circle of where we all know what we're doing, but we need to engage with multiple advocates who are able to fund in a more appropriate way. And that way, people who are wanting to deliver services, such as myself, can do it in an effective way, which means we'll continue to overstaff, we'll have the right training, we'll have inspiring leaders who want to join the sector, because you can't solve a recruitment problem if you don't have people who are interested in joining the sector, and that all bulks down to how are we going to pay for those services.
Lovely. I love how you brought it all together at the end there.
You know,
Perfect.
just you know.
It's like you know
Oh,
what
that's
you're
what I was supposed to talk about. Sorry.
No, they are
I
just
didn't
some of the
look up
points
there.
from the white paper.
I
Don't
didn't
worry.
do I
We
didn't
all
do
enjoyed what you was
records, but
talking
we can
about,
talk
right?
about that if we need to.
No worries at all. Right, we're on the final question for today then, and this is one probably a bit more close to my heart because it's about care tech. So learning from the facts, data and technology intelligence. How can we use artificial intelligence, so AI, and are we comfortable with it? So this is definitely one for Lee Truman.
Yeah, so we always need to use the latest technology. No. Oh, what
Can
about
we
that?
hear Lee? No.
No. Cool.
Ah, look at this.
Okay.
Lovely.
So,
Thank you.
what about that?
Yeah, we
You
can
there?
hear you now. Go
Yeah,
for it.
Cool. So, yeah, AI isn't coming. AI is already here. It's not something that's in 20 years' time, some vision of Skynet. It's in Netflix already. It's in Spotify. So we've already heard today the social care sector or social care society, I'm going to steal that, Adam, is massively overstretched, massively underfunded. We've got amazing care coordinators who have just bogged down, head in a computer, trying to schedule all the calls. So again, we just need to use AI, get more from each of the resources, and that depends whether it's on the rostering end or whether it comes to the diagnostic end with someone like PainCheck. It's using all the tools that are available to get more out of every resource, and we know that we're got a massive recruitment issue, so yeah, we just need to use AI as much as possible.
Yeah, Jane, go for it.
I think there are many different potential applications. So there are some shorter term things like, you know, the machine learning with the rosters. I think what we need to do is challenge ourselves to imagine by the time I get in my 80s, there are going to be double the number of people over 85. We can't cope now with the workforce we've got. There probably aren't going to be substantially more. So we're going to have to think really hard about how we can do things differently. And I know that in social care circles, the topic of things like real-life AI and robots isn't very popular. However, I don't see that there's any choice. And there are some really cool pieces of equipment being developed that, for example, help people to get out of bed, into a chair, over to a sofa and sit down. There are machines that can cook meals in completely from scratch, machines that can fold your laundry, machines that can brush your hair, all of this kind of thing. It sounds a bit dystopian in some ways, but I honestly think by the time I get in my 80s, we're going to be relying on this stuff because there just aren't enough people. Either that or all of the people that are currently working in Amazon warehouses and in retail will have their jobs replaced by robots. So care will suddenly become a very popular place to be.
Mm-hmm.
Oh, no, I was just going to say that's actually a really important point. I actually think it was a missed opportunity with hospitality post-pandemic. I think there was a much, much bigger opportunity for us to attract a set of workforce to create almost like a value-led recruitment that says, look, you've got a certain skill set, whether that be in terms of entertainment through hospitality or whether that was through sort of catering or, sort of front of house, all of those. Especially, again, I'm talking mainly from a care home perspective, but there's so many roles within that. And whenever we talk about recruitment, we focus really heavily on just the care element and not the fact that, 65% of the sector is run by organisations now, not single operators, which means those organisations have finance, have marketing, and there's so much more to care. And I think it's pushing those issues into people, and there was a missed opportunity. So there is one that we should now all learn from that and be ready to bring those people in and make them aware that it's a really, really cool place to work, because that's what we have to do.
Let's not forget, we want to attract the younger generations to social care. So if we can go, you're going to work in social care, and there's going to be robots, and there's going to be AR, and there's going to be VR, it's going to be exciting. But let's not get hung up on the idea that we want robots to come in here and help people with their continence needs and their care needs. If we could get AI and technology to take away all that boring stuff we never want to do, to take away all of that logistical rubbish that takes up our time, so that we can go into work and sit down with Doris and have a cup of tea, or we can take Mike out to play football, or we can go and actually do what we want to do in care, it's going to become a better place to work anyway. So it's not going to be a case of come in and spend your time doing care plans. It's going to be come in, this software's amazing, it tells us everything we need to do. All we need to do is action what that data is telling us, and we can have a cracking time working in care. So the return on investment, like I say, on using technology to get rid of the boring stuff is going to help us. It doesn't have to just be robot maids and people wheeling in and vacuums and all of that. It is getting rid of the boring stuff. This is why the robot revolution will happen, because we're going to give them all the naff jobs, and then one day they're going to come back and not be happy. But it needs to happen.
Let's hope not, hey? So that brings us nicely onto the question kind of element of today. I've got Andy with the mic, I think, or someone with the mic running around. So if you would like to put up your hands, if you've got any questions that you'd like to direct to the panel, forever, go forward. Here we go. There's a lady up here.
Hello.
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 We can hear you.
Angeline Albert from carehome.co.uk. Just a question for everyone on the panel, really, which you can answer individually. From the white paper, what would you have liked to have seen which wasn't there?
Go on then, Adam.
At the end of it, it's not that it necessarily wasn't there, because I think the debate was quite broad and there was lots of things discussed. I think the one that maybe not wasn't there, I think you have to make sure that there is a strategy for where it now goes, and therefore that what's actually spoken about and these challenges are then put in front of ways in which we can make decisions or force decisions to be made that help the sector. That's kind of one of the key things that I would put to it was what are we going to do next? What's the benchmark? What's the measurement? How is that going to be supportive? And therefore the outcomes and conclusions are actually put through to something that it ends up being completed, and we see some value from it. Because again, after a decade of doing this, and I know many people have been doing it longer, there's a lot of stuff said and not a lot done.
In fact, I'd encourage you to read the white paper fully, see what you think might be missing from that. There's an email address on the white paper, and come back to us, and then, in turn, have your say as well. Everybody do that.
Thank you. King Luau, Megacare, home care provider. Do you think the fair cost of care exercise is coming to all councils? I mean, it's essentially started, but it's going to be more later on this year, this exercise for the cost of care model. Do you think that's going to be revolutionary and solve the problem with regards to the cost of care? Yes, please. Yeah.
Do you want my?
Thank you.
Do you want my honest answer, or
Yes.
do you want my answer that you?
Both.
I think
Both.
it'll do as anything does with any cost of care. I wear another hat, which I work in I run and involved in a number of trade associations and have direct contract negotiations with commissioners and have done for 6 or 7 years. And basically, nothing will be done with it, nothing whatsoever. It will be another piece of work that a lot of money is spent on, and nothing will ultimately come from it. But that's because we're looking at it the wrong way. It has to be provider-led. It has to be, let's build it, educate people on what services they require, and therefore they will want, if they know exactly what's available to an individual when their choices need to be made about the care services they want, and they say, I want that, and the local authority says, no, but we're only going to fund that, the general public will start saying, well, why? I want that service. Why won't you allow me to access it? And what will start to happen is they'll go, because we don't want to pay for it. And then we can start having a proper conversation. What's going to happen is we're going to have constant debate and spreadsheets, and people are going to put loads more data, but nothing's ultimately going to get done until the network of providers actually go, this is what we're charging, this is what you get for that. We have to be much more transparent. We can't have too much, it doesn't help that every time you start charging more, somebody ends up in the paper that they've got a Bentley and, 19 houses. Things like that don't help, but we have to be very, very clear what people are going to get for the services and how much they cost for us. That'd be great. But it won't be solved by the local authority. And if we think it is, we'll give up now, because they don't have a clue what they're doing.
Go on, Jane.
Yeah, I think the concept of a fair cost of care is a good one. The problem is that they've probably put in about 10 times too little money, and therefore it's going to create risk, because if they start to try and dictate what the cost, what providers can charge, that's going to destabilize the services. And also, a lot of citizens, I think, have been given the idea that they're going to be able to access care at local authority rates and so on. And that's going to, I think, cause quite a lot of difficulty too. They're going to have a lot of appeals. I think on the positive side, the fact that local authorities have to do this exercise means that they will be forced to pay attention to provider costs and to try to understand them. My concern is that their providers are being asked to put in current costs, and it's sort of potentially baking in poor practice. So just as a current example, you know, many home care providers are only paid enough to pay mileage rates of, say, 10p a mile, in contrast to the NHS, which receives 54p a mile. So they're going to put in their cost of care exercise, our mileage rate is 10p a mile. No one thinks that's a good idea, but that then becomes, you know, sort of set into the whole system. And the problem fundamentally, you know, I don't know if there's any local authority commissioners here, but most of them would like to pay more than they are, because they know that there are problems with recruitment. They want the workforce to be better rewarded. They're not all sitting there going, "Mwah, ha, 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 you know, how can we screw you over?" They're really not. But that the money just isn't in the system, and until we get that, we're going to be stuck.
But you talk about money not being available. Well, there's the crux of the problem, because there's plenty of money available, but it's in the wrong place. So if we keep barking and up the same tree of saying we need more money, you get the same thing as, well, it's mainly a predominantly private operated sector. Therefore, we don't want to give more money to those people. Therefore, it has to go to the NHS because that's votable, and therefore I can win a seat on that. So we're still going back to the same point that I think which runs through all of the questions of this white paper, around the fact that there is plenty of money in there, but we're not getting it to the right place. But it's how do we solve that? That's kind of like the crystal. How do we get to a point where we can break the back of going, the money that's been spent here will be more effectively spent there, and therefore we'll have a better outcome. There are certain people that control that conversations that aren't allowing that to flow. There has to be, because anybody who just takes any analysis of a local authority versus the NHS can see that the reward versus the income is totally skewed.
I think it's going to revolutionise care by making the postcode lottery of access to good care true. That, for me, is going to be the honest answer. I think it's going to cripple a lot of businesses, and I think we need to ask ourselves that the local authorities are busy enough as it is at the moment. Care coordinators are busy enough as it is at the moment. If we then allow the public, and I'm not saying they shouldn't be allowed, they should, but if we then say to the public, look, you can go and ask your local authority to go and source that care for you, they're going to have to get a load more people to come and work at their local authorities to do that. They're not going to take that from the 30 billion that the NHS are getting from the increase in the levy. They're going to take it from our minuscule 5 billion. So as much as this money is coming towards social care, it's going to get siphoned off into all the wrong areas, just like we're saying. So they will be revolutionary by putting a final nail in the coffin for social care, in my opinion.
The most annoying thing is that some NHS trusts are starting to deliver home care themselves because they've got the money, and that doesn't seem like a very good way of going about things either. And that, they're only doing part of it anyway, the hospital discharge part. So it's difficult to operate efficiently.
Is there another question from you?
1, 2.
We can hear you now.
Yeah, I don't want to depress you further, but I started owning care homes in 1979, and I've been listening to this same argument year in, year out, and white papers, royal commissions, and I still can't see anything being resolved until we make surgeries, discharge, mental health teams, community services, and the private homes, give them a little bit more trust and respect, and put them all online so that they don't keep losing DNARs. And in Norfolk, we have got the worst of all sorts of things. Our local authority is the worst performing in the whole of East Anglia. Our ambulance service in Wells next to sea is the slowest in the country. We've had issues with all sorts. Most of our hospitals are inadequate. Our mental health team is the worst in the country, and we are getting hammered and trashed all the time for £110 a night. And that's after our big pay rise this April, and it's 180 to stay in bed and breakfast in Wells next to sea, and if you defecate in the room, you get thrown out. And if you still have to buy your drink and your meal, and if the toast is cold, you don't go to prison.
So we don't have any time to answer, but we can see the passion from the audience, and I think you made a lot of points there. So what I would encourage you all now to do is thank you for your time for coming today, and thank everybody that participated in the round tables that's come, and can we give a round of applause to the panellists as well. If you can all fully read the white paper that you have, if you don't have it, please come and see me. I can make sure that you get a copy and then have your say. There's some further points that were discussed that weren't here today, so you'll have even more insights and solutions there. Thanks for your time, everyone. See you.